Hey, what if the most important predictor of your future health was not your cholesterol or your weight health or even your blood pressure? What if it was your sleep? I just spent 3 days immersed in a sleep medicine conference with experts from all over the country and even international experts in sleep medicine, talking about the importance of sleep as a biologic necessity, not as an optional thing that we may or may not do some nights. Sleep is necessary physiologically. And in fact, in 2015, a manuscript was published in the National Sleep Foundation Journal, noting that sleep should be considered the fifth vital sign, as important as checking your blood pressure, your heart rate, your temperature at any doctor's visit. We spent 3 days discussing the impact of sleep disorders on cardiovascular risk, the risk of mental health conditions, the risk of other neurological conditions, the way to treat insomnia, the way to diagnose circadian rhythm disorders. So sleep is more than just sleep apnea. And I think we've gotten better in our country about screening for obstructive sleep apnea because it affects a large percentage of our patient population. But we miss a lot of other sleep disorders that we're often not screening for. Sleep is required for your immune system function, for your development in terms of emotional health, of cognitive health. It impacts your metabolic health, and it impacts respiratory conditions as well. And yet, despite the impact of sleep disorders in every other medical condition that we see in many different specialties, we really under-recognize the impact of sleep, not just how it may impact physiologically, the increased risk of heart disease, the increased risk of cognitive decline, but also how it impacts our patients' ability to function and take their meds, for example. So if we're forgetting to take our medications for everything else that we're battling because we're sleep deprived, because we are not getting a good quality sleep, it has tremendous impact on your overall health. I'm Dr. Guzman. I'm a triple board certified physician in sleep medicine with training in mind-body medicine. And I see this every single week. I see patients with insulin resistance, with prediabetes, type 2 diabetes, high blood pressure, abnormal cholesterol. Those are metabolic factors. And I also see a lot of patients with anxiety, depression, overwhelm, symptoms of burnout, difficulty concentrating, and getting diagnosed with attention deficit disorder. And very often, sleep hasn't been discussed by their primary care doctor. Not just do you have symptoms and a risk for sleep apnea, but how long are you sleeping? Are you feeling restored in the morning? Do you feel refreshed when you wake up? Is your sleep fragmented throughout the night? The literature is clear that sleep disturbance is both a predictor and an amplifier of chronic disease. So I want to talk today about why sleep deserves the same clinical attention that blood pressure, temperature, and heart rate, and what the data clearly shows. So number one, it's a problem. The Institute of Medicine estimates that 50 to 70 million Americans in this country have a sleep disorder. On average, Americans report that they have 2 nights a week where they don't get enough sleep. And about 40% of Americans are sleeping less than 6 hours per night. So this is a public health problem. And yet, despite this, many primary care doctors are only screening for obstructive sleep apnea and missing this potential condition in women because the screening tests tend to underestimate the likelihood of sleep apnea in women. And we're not screening for any other sleep disorders like restless leg syndrome, chronic insomnia, hypersomnia, disorders of excessive sleepiness. There was also a recent study in Spain in 2025 showing that at a population level, it was estimated that 13.6% of adults met criteria for chronic insomnia. And yet the charts of those patients, only about 5.1% had the active insomnia diagnosis documented in the primary care doctor records. So patients are experiencing this at a population level, but it's being missed in their medical chart, and often because the doctors may not be screening appropriately for these conditions. So that means chronic insomnia is completely under-recognized. Why does sleep matter biologically? Sleep is not a passive process where we close our eyes and we wake up the next day and just are unconscious for that time. During sleep, which is necessary for our brain to recover and get rid of toxins that build up during the day, to process emotions, to process memories, it is a primary function of your cognitive, your brain, your thinking health. There's a famous quote that says that if sleep wasn't absolutely vital to our function, then it would be the biggest evolutionary mistake ever made. Sleep is necessary for our health. When sleep worsens, health worsens. When sleep improves, multiple systems will improve in function. That is the definition of a vital sign. So why are doctors missing this diagnosis of chronic insomnia so often? We have limited time with patients. There's a lot to cover in a primary care setting. There's a lot of clinical priorities that take precedence. There's a lack of standardized screening for insomnia or for restless legs among primary care doctors. And there's variability in terms of the training in sleep medicine that a primary care doctor may have. So why is sleep something you should discuss with your primary care doctor, even if they don't ask you? Because if you're not waking up feeling refreshed, if you're waking up multiple times throughout the night, if you're having trouble falling asleep or trouble waking up in the middle of the night and trouble falling back to sleep, those are all signs of fragmented sleep. And that puts strain on your cardiovascular system, and it decreases the restorative time of sleep where your body recovers and repairs. That increases the risk for inflammation, the risk for pain, the risk for heart conditions. So it is paramount that if your doctor doesn't bring it up, you do your due diligence and bring it up yourself. And don't leave it for the last 2 minutes of the appointment where the doctor may only be able to give you a pill just to help you out in the meantime, because access to other first-line treatment options like cognitive behavioral therapy are limited. There's not a lot of people that do this type of therapy. It's very intensive therapy, time-consuming, and so it's a lack of, and so it makes accessing that type of treatment very difficult for patients. The easiest thing is to give you a sleeping medication. The problem is, how quickly are they following up to see if that treatment was effective? What side effects did that treatment have? And over time, what I see as a sleep doctor is that we may try many different sleeping medications, and they tend to wear off in terms of effectiveness, or over time, the side effects become problematic. So what is a vital sign, and why is sleep a vital sign? A vital sign reflects the physiologic stability of the body. It predicts morbidity and mortality. It guides treatment decisions. It is easy to assess, and it is relevant across specialties. Sleep is relevant in every specialty that you're going to see. It meets every single criteria. Changes in sleep are relevant in psychiatry, mental health, in neurology, in cardiology, in endocrinology, in rheumatology, in oncology, pediatrics, and geriatrics. In every specialty, we see patients that may struggle with their sleep because of the medical condition that a doctor is seeing them for, or just because they have a predisposition to insomnia or other sleep conditions. In 2022, the American Heart Association formally added sleep to its cardiovascular health checklist, which is known as Life's Essential 8, recognizing that 7 to 9 hours of sleep are essential for optimal heart and brain health. So sleep is not just a symptom that you go to the doctor when it becomes unmanageable. Sleep is something that tells us about the state of your nervous system, the state of your biology, of your circadian rhythm, and it amplifies health outcomes in every other specialty. When sleep is poor, self-care collapses, health outcomes worsen. And when sleep improves, health outcomes and quality of life improves. So with all of that being said, what should we be doing differently? The sleep health authors of that 2015 paper, where they argued that sleep should be the 5th vital sign, they recommend incorporating at least one basic sleep question into any routine patient evaluation. It doesn't require a 30-minute consult. It can just be like, how are you sleeping? How many hours are you sleeping? Or do you wake up feeling refreshed? That starts a conversation, that brings up the topic, and that gives you an opportunity to talk about where you're struggling with your sleep, if you are. And if you are struggling, advocate to have a sleep medicine consult. So if nobody asks, we assume that things are fine. If nobody brings it up, it may just fall as something that's not important. But sleep may be the earliest warning sign of something that's not going well with your physiology. It may show up before high blood pressure happens as a result of sleep apnea. It may show up before prediabetes happens because of disrupted fragmented sleep and sleep apnea. Before depression happens because of sleep deprivation and inability to maintain restful sleep. Sleep is not optional. It's foundational physiology. So share this with someone that needs to hear it, with someone that this may help. And it's time that we treat sleep like the vital sign that it really is. Thanks for watching. I'll see you on the next video.